Arrhythmia, improper beating of heart. What is the normal beating of heart? There is phases: phase 0, phase 1, phase 2 and phase 3. In phase 0 there is sodium channels which are working. In phase 1 potassium is working. In phase 2 potassium and calcium is working, and in phase 3 potassium is working. Phase 0 sodium, phase 1 only potassium. In this they start repolarization. Phase 2 potassium and calcium, this is also called plateau phase. Phase 3 only potassium. Now this is an electric impulse. So how the electric impulse goes? RMP, resting membrane potential. Resting membrane potential of myocardium is minus 70 millivolt. So now this is minus 70 millivolt. During phase 1 the impulse give rise in phase 0. Sodium channel or sodium does depolarization. After depolarization, when it reaches maximum depolarized state, now it will do repolarization. This is phase 1. In this phase 1 potassium is doing repolarization. After this there is a plateau phase. This one is phase 2. Here both of them, potassium is also working and calcium. At the end it comes to minus 70 millivolt. This is phase 3, where only potassium is working. So this is the cycle it begins. So by giving potassium sparing diuretics we can increase or increase the slope. So here first point we can write here: sodium channel blockers decreases slope of phase 0. This is the formula of this: dV by dt. second point here, potassium blockers can increase AP duration, action potential duration. If normally this is normal, in potassium blockers they'll increase the action potential. So just opposite, if potassium openers, what they will do, they will decrease AP, action potential duration. This action potential duration in ECG, normally we see there is a P wave, Q, R, S and T. In this, in potassium blockers, in potassium blockers, what we can see QT segment increased QT segment. Or QT interval. Increase QT segment or QT interval, this is torsades de pointes. Sodium channel blockers can cause torsades de pointes, increase QT interval. Now let's come to drugs. So drugs will classify Vaughan William classification. Classes. There is 5 classes. Of drugs. 5th class is others. First we can give sodium blockers. We can give beta blockers, give potassium blockers. You can give calcium blockers. Sodium blocker, beta blocker, potassium blocker, and calcium blockers. So now one by one we'll discuss all the drugs. That is sodium blocker. Sodium blocker, this is class 1 drugs. So what they will do, you have already known that in the 0 phase there will be sodium channel working. Phase 0, sodium, which will repolarize in the phase 1 where potassium is working, and there will be a plateau phase. This plateau phase, this is phase 3 where potassium and calcium both are working, and in this is second phase. Both are working, potassium and calcium, and in the third phase only potassium is working. It is coming to resting membrane potential, that is 70 millivolt. So what will happen where sodium is working? In the 0 phase. So this will be delayed if we block sodium. So what it will do, it will decrease the slope in phase 0. Now there are 3 classes. This is of class 1, right? So in first class we have 3 subclass. Class 1A, class 1B, class 1C. These are all sodium blockers, okay? These are all sodium blockers. This is the first property. Second property, class A, they are also potassium blockers. Class B is potassium openers. And class C, they don't have any effect, they are pure sodium blockers. Now class 1A, who are sodium blockers, potassium blockers, right? They are quinidine, procainamide. One B, who are sodium blockers and potassium openers. Lignocaine, phenytoin, and troconide. Lignocaine, phenytoin and troconide. Class 1C, which are only sodium blockers, and others they don't have no effect on potassium channel. They are encanide, flecainide, propafenone, encanide, flecainide and propafenone. These are the three class 1 drugs, 1A, B and C. Once more, let's just repeat this all. These are class 1A, 1B, 1C drugs. They both have, all of them have sodium blockers. They are all sodium blockers, so first group. But other than that, they have effect on potassium channel. One is potassium, 1A is potassium blocker, and B is potassium opener. In the three, they don't have any effect. So now they have 1A is quinidine and procainamide. Quinidine and procainamide. Class 1B is lignocaine, phenytoin, lignocaine, phenytoin, trocanide. And 1C, encanide, flecainide and propafenone. Now let's check about class 2 drugs. Class 2 is beta blockers. Beta blockers previously already told about beta blockers. Those are ending with lols, carvedilol, class 2, those are beta blockers which ends with lol. We have already discussed in previous videos about beta blockers. These can cause tachycardia. It can be either atrial tachycardia or ventricular tachycardia. And how this occurs we can discuss in ANS. We'll upload this video afterwards. ANS drugs. Now let's go to class 3. Class 3 we have potassium blockers. What they will do, potassium blockers? Here phase 0, sodium is working. Phase 1 potassium, phase 2 potassium calcium, phase 3 potassium. So here, here and here there are 3 potassium working in 3 phases. So if we block, this one will elongate. This is also called torsades de pointus. These are, to remember the names, we can put in a mnemonic of Bindas. Bindas, Berthelinium, Berthellium, Berthellium, Ibutylide, D for dofetide, tylide, dofetilide, for amiodarone, sotalol. See, LOL. So this is beta blocker, also potassium channel blocker, dual action. So this one is both class 2 and class 3. Amiodarone, this is few words about amiodarone. Longest T half is more than 3 weeks. Mode of action, these are class 1, that means sodium channel blockers. These are class 2, which is potassium channel blocker. These are class 3, beta blockers. Sorry, class 2 is beta blocker, class 3 is potassium channel blocker. What I am telling, beta blockers, potassium channel blockers. And class 4, calcium blockers. So that's why amiodarone used in all arrhythmias. Except torsades de pointus, where we need to use potassium openers. Now the adverse effects. I will remember the adverse effect. The periphery of my lungs and cornea is photosensitive. They can cause hyper or hypothyroidism. They can cause peripheral neuropathy. They can cause myocardial depression. Can cause pulmonary fibrosis. They can deposit in cornea. And cause photosensitivity. Now class 4 drugs are calcium channel blockers. We have already talked about those, but we'll just talk a little bit more. We already know about calcium channel blockers because we already told in previous video. Those are verapamil, diltiazem, and dihydropyridines. Those are ending with dipines. So now verapamil and diltiazem. This can cause in heart tachycardia. Either atrial or ventricular. This is only for decreasing blood volume. So to decrease the load of heart. Never mix beta blockers plus either verapamil or diltiazem. Otherwise, if you mix both of this, it can cause severe depression of heart. Or hypotension. Class 5 drugs. Others. What do we use? We can use digoxin, atropine, adenosine. Digoxin, when it is used in atrial fibrillation. Atropine is used in anticholinergic. We'll talk about anticholinergic in CNS. Decrease heart rate. So that's why this is a drug of choice in bradycardia or AV block, atrioventricular block. Adenosine, these have short action whose T half is less than 10 seconds but very strong. That's why drug of choice is paroxysmal supraventricular tachycardia. Paroxysmal supraventricular tachycardia. That's it.